Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week.
Yeah, so we're Elida, and we are restoring continence, but really confidence in women. So I probably don't have to remind you how common it is, 1 in 3 women over the age of 30. But I also wanted to point out how really depressing it is and how early it starts. Lots of times earlier than people think. A lot of people think of the old people. And I've talked to so many women who would even say, "Oh no, I don't have incontinence. Oh yeah, I leak. I have bladder leaks, but I don't have incontinence." But it really starts to affect their quality of life in terms of their emotional aspect of it. They get embarrassed. They stop going out. They stop being active, and then it's costly too. There is a study that shows women on average spend $750 a year on maintenance, on not even a treatment, but on pads and laundry and just taking care of that. So we are really trying to disrupt the incontinence industry. And what I mean by that is what they are hearing and what they're being promoted and what they see advertisements are the pads. And incontinence pad market is $6.8 billion, and it's just going up. And we want, people to know that it does not have to be a part of your aging life. You can go and get treatment. Actually, I believe the World Health Organization said it was the only condition that was like a disease state that was completely or mostly reversible. On the other side, we want to disrupt the medication market. Over $3 billion on these incontinence medications, and a lot of them have such horrible side effects. So if you ask the question, what would be the most ideal treatment if you were to design things from scratch? And we've interviewed hundreds of doctors and patients. The thing that comes up with the most is something that patients would actually use, which means easy. And when we say easy, we're talking about at-home use. Doesn't take a lot of their time. It's non-vaginal, because the vaginal devices mean that they have to lock themselves in the bedroom, be flat on their back for 20, 30 minutes, and no busy mom has time for that. It should be discreet. They don't want anybody to know that they're getting a treatment. And it has to be non-medication. Lots of times they have other medication and they don't want anything interfering with the other medication. No adverse events, and of course, effective. And so that was what we set out to do and accomplished. So Elitone is the only non-intrusive treatment for bladder leaks anytime, anywhere. And I say non-intrusive in that not only is it physically external and non-vaginal, but it's non-intrusive on their time. They don't have to schedule time to just sit, or be flat on their back for 20, 30 minutes. So it's composed of a device, a small controller. I'll hold one up so you can see kind of how tiny and little it is, about the size of a matchbox, really. Rechargeable, and gel pads. And these gel pads are super thin, about this, as thin as a paper. And let me just show how flexible it is. So it's flexible and comfortable. And these gel pads are reusable and then disposable. So we have Elitone for the stress incontinence, and just this year, Elitone Urge for overactive bladder. Now, to give a little bit more detail on this, this gel pad has adhesive hydrogel, and that's the conductive areas. That is essentially we're delivering electrical stimulation through the perineal tissues. It's user controlled, and so the patient simply needs to increase the intensity button, go as high as she can go. So because everyone's body is different and the level that they get stimulation will, vary for everyone. And super simple, easy user interface. As I mentioned, it can be reused 3 to 5 times and then they can dispose of it. Some of the most common questions is, do they need a shave? Well, it does need skin contact. So we recommend trimming the hair, but not necessarily shaving. And it does not pull hair. This gel comes from the wound industry. Now, so what it does, Elitone tones the pelvic floor muscles, and that results in fewer leaks as it strengthens and the urethral sphincter is stronger. And then the Elitone urge calms the bladder muscle spasms, reducing in those leaks. And you can see the perineal placement in this picture. So we say it's easy, external, and ineffective. She simply applies it to her perineal area, clip on the little controller, adjust it to as high as she can withstand. There are 35 levels in this controller. Get dressed, and then she can walk around the house, do whatever she needs to do while she gets a 20-minute treatment at home. And as I mentioned, it contracts the pelvic floor muscles for the stress incontinence and then calms the overactive bladder. We recommend 5 times a week for a period of 6 weeks. That is the initial treatment, but really some of these women need to go 6 to 10 weeks. Often these women, they wait so long before they get any treatment that they've waited like 10, 15 years of being incontinent before they decide that, okay, I need to get some treatment. So they may need to go longer. Now, what makes the inside different is that we have really 3 modes of action. The first one is 2000 hertz frequency. And the reason why that's important is it gets past that skin barrier, past the fat barrier, directly deeper into the muscle. And so that's the targeted delivery, the carrier wave. Now then, what it's pre-modulated, so what the muscle actually sees is this 50 hertz. And that is what the muscle knows at 50 hertz to contract the muscles. And we send that for 4 seconds. And then we alternate and we send it 10 hertz, which calms the overactive bladder. We cycle, so that's 6 seconds of stimulation and then 6 seconds of rest. We cycle through that 100 times in a 20-minute period. So it's really longer and stronger contractions than she could do on her own. If she, when you tell women to do Kegels, maybe they could do, a set of 10, 5-6 minutes, and then, their muscle gets tired or they just can't do it strong enough. So that is the Elitone, original Elitone that has been on the market for about 3 years. I know this ultrasound is not moving right now, but what we did was we did an ultrasound study to actually physically see the bladder or the pelvic floor muscles contracting and moving the bladder. It was kind of interesting because in this ultrasound study, we would say, okay, now do a contraction, Kegel on your own. And they are. And they would say, yeah, I am. And we're like, we don't see anything moving on this ultrasound. And then with our device, you can see that pelvic floor moving. Now, I'm sure you're wondering about the efficacy. So we've done a number of clinical studies. In one clinical study, 95% of the women improved. The average improvement was 71% in a short 6-week period. And in this study, women were incontinent for 11 years on average. So that is incredibly fast treatment. They all said it was comfortable, and there was an 85% pad reduction. Now, the FDA considers 50% improvement clinically significant, and in the studies, was 75% clinically significant improvement. In a different study, we did a randomized control trial against a sham device. Now, this sham was our own device, but with an active stimulation, but not the original stimulation that would contract the muscles. And we saw a big difference in the Elitone and the sham device in both leaks, pad use, and pad weight measures. Just this year, we got FDA clearance on the Elitone Urge device. That becomes the first at-home treatment for urge incontinence. It looks almost identical. It's used in the same way, same recommended regimen. In this study, 97% of women improved. 76% was significant improvement. And a lot of the same outcome measures. The IQOL, quality of life questionnaire, improved 21.8 points, which is over like 10 times what the FDA considers significant. All 22 metrics of the QOL improved. One thing I would mention about the Elitone Urge and how it acts is it acts directly on the perennial nerves and tissues, whereas the tibial stimulation out there is on secondary ones, peripheral nerves. And so direct stimulation is going to be better than the secondary stimulation. Oh, I forgot to mention the difference between the Elitone and the Elitone Urge in the stimulation. It still sends out the 2000 hertz as the carrier wave, but it sends only the 10 hertz that is the calming signals for this product. So how would the patient get this product? We sell it for about $400 over the counter and prescription. And when I say over the counter, it is actually more stringent to get an over the counter indication. That means to get the over the counter indication, it has to be dummy proof. And the reason why we're doing this, we're not trying to go around the clinician. It's just we are meeting the women where they are. And 2/3 of them do not talk to their doctors. They're just searching for something online. And so we want to be able to provide women with a treatment where they are. So this treatment of $400 comes with the Elitone device or the Elitone Urge and 2 packs, which is 10 gel pads. We sell it almost entirely on our website, elitone.com, but also on the CVS pharmacy online, cvs.com. And we make it very accessible in that they can pay for it with HSA, FSA funds. We have monthly payment plans so that they can pay $34 a month. I mean, that is cheaper than pads. I saw a study that shows that women on average are spending $60 a month on pads. We have nationwide Medicare approval coverage. They make them jump through some hoops, of course, that they need to have shown failed 4-week structured program. Medicaid covers this in 22 states. Most of the private payers cover it with a lot of restrictions, of course. And considering that we give a 60-day guarantee, which is more than any of our competitors and is longer than the actual treatment period, we are finding only a 3.6% return rate for non-efficacy, in that it is highly effective and women are motivated to really make this work for them. Now, you may ask, okay, there are so many recommendations. Where does this really fit when I am talking to a patient? So we recommend it be the second line of treatment. We know Kegels will always be first line and behavior modification. But right after Kegels, they've tried Kegels. Maybe it works for a while and then it stops working because they forget to do them, or they just can't figure it out. We recommend the Elitone device to be used right after that. The recommendations, of course, are always based on severity. You're not going to recommend surgery when they have mild incontinence, but our device kind of fits quite the length of from mild all the way to right before surgery. And it is this infographic kind of shows the mild to severe versus the invasiveness. So for the least invasive, it's the most efficacious. Now, on the overactive bladder side, we again recommend it as a second line treatment after diet modifications. But when you compare the risk and side effects to the 2-year cost, it is, again, the least risky and the least expensive. So I like to end with just some of the language that the women use. So like Marty in the middle, she says, I had 10 children. I didn't think anything would help. And then Nancy talks about, I am not afraid. I mean, some of these language, without fear. Oh, Joella, we were talking to Joella's daughter, and she completely would not go out of the house anymore. And now she says she can go anywhere without fear. So that is why we do what we do. And I know with all of you, we can get the word out and it be, a nice, effective, cost-effective treatment for women out there. And our goal is so that people don't, wait until the very, very last minute to get treated, because they're absolutely desperate. We're hoping to reach women earlier. So thank you.
Hey, thanks, Gloria. That was really interesting. Hope everybody enjoyed the show. And be sure to check us out, UroPatient Podcast at uropatient.com, where we bring you great information every week. See you next week.